Welcome to Celebrating Act 2. Celebrating Act 2 is the user manual for the second half of your life.
Welcome back. We're here today with Dr. Liz Lister and my partner, John Coleman. And today we have a very interesting topic. Where are we going with today, John?
Well, Dr. Liz, I was flipping through your recent bestseller. Congratulations, by the way. Go for Great. And one of the issues that I wanted to raise up from that book is about sex and libido, because once you're hit 50, it kind of all changes. And as you get older, the relationship changes, sex changes, everything changes. And I don't think people below 40, under 50, let's say, really have a sense of how it changes. I think we ought to talk about that. Sex and the sex drive and physical sex, it changes too.
Exactly. Absolutely. I love talking about this topic because libido is not only about sex. It's about everything. It's about life, energy, motivation, and we have a lot of living left to do even after we cross 50, and I always say 60 and better. That's how I do the categorizing.
It's a good way to do it.
So 60 and better, are we going to get to 70 and better?
Of course. It just gets better and better.
Good.
So about the book isn't just about sex and libido, which is what I want to talk about today. Of course, I always want to talk about sex and libido. But tell people what the book is, Go for Great.
Yes, the book is Go for Great, Dr. Liz's Guide to Thrive at Every Age. Okay. And this book is about not settling for just okay. Not having your doctor tell you you're just getting older and therefore you just have to accept it. I call the word just, I call it the J word. And I invite people in the book to reject the J word and rather than settling, to go for great in every area.
Good.
So
Good.
this is actually part of your practice is helping people not only psychologically, because it's not all medicine, it's not all supplements, it's also having people understand and dealing with things differently than they did, as far as my view of having observed you for the last few years. But are there also hormone therapies that you can recommend for people under certain circumstances?
Yeah, absolutely. I am a big fan of hormone replenishment. I heard Suzanne Summers speak not too long ago, and she said, if you're not feeling great and you used to have better levels of hormones that help you feel better, why wouldn't you replenish those? All right. And people are worried about the safety, but I talk about this in the book. I talk about this in all of my writings and blogs, that there are ways to do hormone replenishment that are safe and effective and help people really feel great, particularly area of sex and libido.
Dr. Liz, female menopause, male menopause are completely different in many respects. And we've talked about this a lot before. When a woman is going through menopause, it affects her ability, psychologically and everything else, ability to have sex. And it affects her libido, her desire to have sex. And I'm not sure that's true with men. So what do you recommend?
Okay, so you alluded to the hormonal changes that we go through as we all get older. The main difference for women and men is that for men it's more gradual. For women it's more noticeable. We go through, I call it the stock market phase, because the levels go up, down, up, down, up, down before they finally come out very low on the other side when women are in menopause. The place that I start with most women is, what is the physical impact? So as you said, you're 100% correct. There's a huge mental component. Sometimes sleep is disrupted. That definitely affects how we feel, women in particular. However, women, as our hormone levels go lower, we can have impacts on, For example, the vaginal tissues can get thinner and feel dry or irritated. And this is very important because, as I always reassure women, it's normal to not want to do something that hurts.
Makes sense.
Okay, right? Exactly. So that's the first part. And the second part that most women don't realize is that they can use, for example, a little bit of estrogen. There are over the counter lubricants, that type of thing, water based lubricants that are excellent. And women can use a little bit of vaginal estrogen safely without affecting, it doesn't help other symptoms like hot flashes or night sweats, but by the same token, it doesn't have any negative impact on the rest of the body. Okay, I've had women who've been declared, maybe they don't use the word cure after breast cancer, but at least in remission. And their doctors have allowed them, their oncologists have allowed them to use a little bit of vaginal estrogen so that they don't suffer from bladder infections and they can be intimate with their partners in a comfortable way.
I think one of the most important things that I've derived from watching you over the months is um, the the difference between hormone therapy and drug dependence. And that doesn't mean that people who don't use hormones shouldn't continue to use them, or they may have withdrawals from and get the symptoms back. But it really is a lot different than somebody getting a drug dependency where it could really mess up their lives. Can you address that a little bit? Because I think it's something that scares people off from taking supplements and hormone replacement therapy items as opposed to not taking them.
Yeah, that's great. I love that, Art. That's exactly right. So, what's happening? 2 points I want to make. First of all, we're replenishing back into the body what it used to have enough of. So, that's one of the main differences between using a drug. I refer to the analogy of a tree. You've got the roots of the tree, and then you've got the roots at the bottom. You've got the tree trunk, which is the main strength and structure of the tree. Then you have the leaves and the fruit. So most pharmaceutical drugs are treating the leaves and the fruit. And what we want to do is look at the root cause, okay, which would be treating the roots and strengthening the main trunk part of the tree. So I like that analogy. So that's what we're doing in the body when we're replenishing hormones. And the second important point is the word bioidentical. Bioidentical hormones are either almost exactly the same or exactly the same as what your body used to make plenty of. You know, back in the days when we were 20, we could pull liters and outlets and we could injure ourselves and recover quickly. Back when all the hormone levels were super optimal. Okay. So we don't have to go back all the way that far. As I always say, there's a reason we don't want 20-year-olds running the world. Okay. But we also want to feel good. And I don't want people to be afraid of replenishing hormones, especially when they use them in the bioidentical way.
Well, thank you for that, because that actually clarifies it even more for me. And it's one of the reasons why I feel so comfortable with our interviews with you and the information that you're sharing with us. Any other last words for you, John?
No, I really like your attitude, and that is don't settle. Go for great. Great title for a book, by the way. So thank you. And when it comes to sex and libido, as you get older, it's really important. You're not out making babies anymore, but the intimacy factor is very important. So people shouldn't settle. People should do whatever they need to do to keep that intimacy, physical and mental.
And I'd just like to finish off today by putting in a shameless plug. If people want to reach you, Dr. Liz, where can they go?
My website is the best way to reach me, www.drlizmd.com. It's drlizmd.com. They can contact me. They can write to me. You can see other blogs, videos, content, and please comment. Everyone is welcome.
Thank
Good.
you.
And of course, they should also go to Celebrating Act Two on YouTube, where they can see a playlist of all your videos you've done with us.
And binge
Thank
watch.
you, Art, for putting that up. And binge
Binge
watch.
watch
I love
Dr.
that
Liz.
idea.
Dr. Liz. Great. Well, thank you for another great session, and we look forward to seeing you again soon.
Likewise.
For more on Celebrating Act Two, visit our webpage, follow us on Facebook, subscribe to us on YouTube, and tell your friends. Celebrating Act Two is the user manual for the second half of your life.